Good afternoon, and thank you for joining us for today's coronavirus technical briefing, which is being hosted by the Minister of Health, the Honorable Kim Wilson, JP, MP. Minister Wilson is joined today by the Chief Medical Officer, Dr. Ayo, and Dr. Wesley Miller, the Chief of Staff of the Bermuda Hospitals Board. We'll begin with remarks from Minister Wilson. Minister?
Thank you. Good afternoon, everyone. Sadly, I begin my remarks today by reporting that since the last update on Monday, Bermuda has had another COVID-19 related death. I extend my sincere condolences on behalf of the people and the government of Bermuda on the passing to the family and friends, and our prayers continue to be with you. As I have said repeatedly, the pandemic is not over, and the Omicron variant continues to circulate throughout our community. Our positive cases are increasing, and it is important to note that new cases are outpacing our recoveries. Since our last update, there were 3,264 tests received by the Ministry of Health, and 105 were positive for COVID-19. These results are from testing that was completed on Sunday, where 14 out of 460 tests were positive, giving us a positivity level of 3.0%. Monday, 8 positives out of 1,300 results, giving a positivity of 4.4%. And Tuesday, 33 positives out of 1,479 results, giving a positivity rate of 2.2%. 5 of the new cases are classified as imported with a history of travel in the previous 14 days. The additional 100 new cases are classified as either local transmission, namely 48, or under investigation, 52. Additionally, there were 90 recoveries. There are 271 active cases, of which 265 are under public health monitoring and 6 are in hospital with 0 in intensive care. From January 11, 2021, when Bermuda's vaccine campaign began, to March 12, 2022, Bermuda has experienced 393 COVID-related hospitalizations, and that includes repeat admissions, of which 312, or 79%, were persons who were not fully vaccinated, and 81, or 21% of those persons were fully vaccinated. In addition, since we began our vaccine program again on January 11th last year, we have had 113 deaths, of which 95 or 84% of those deaths were persons who were not fully vaccinated, and 18 or 16% of those deaths were persons who were fully vaccinated. And sadly, the total number of deaths related to the coronavirus illness in Bermuda is 126. I will now provide an update on our vaccination program. Again, since January 11th last year, Bermuda residents have received a total of 126,461 vaccinations. And of that 26,461 vaccinations given, as of March 12, 2022, 52% of those were women and 48% are men. 87% of all of our residents over the age of 65 have had at least one vaccination, and 85.6% are fully immunized. To date, 75% of the population has been vaccinated with one dose, and 72.5% of the population has been immunized with 2 doses. And additionally, 72% of those eligible for a booster have received their booster. As a reminder, the vaccine booster appointments are available until the 31st of March at Pier 6 by appointment or walk-in. Now, after March 31st, the COVID-19 vaccine will be available through participating physicians' offices and participating pharmacies, and they will likely be a charge associated with this service. So I encourage anyone who wants to get vaccinated to register their interest at gov.bms/vaccines as soon as possible. And if you are eligible for your booster, please get it. Studies released by the CDC show that the booster provides improved protection against severe illness and hospitalization due to COVID-19. Parents wishing to get the COVID-19 vaccine for their children between the ages of 5 and 11 should register as soon as possible, as our current pediatric vaccine supplies are limited. Parents should first register their child on gov.bm/vaccines and then contact their pediatrician to arrange to get the vaccine. If your child does not have a pediatrician, you can contact the Hamilton Health Clinic on 332-8906 for assistance in scheduling an appointment for your child. Moving on to the public health legislation. Cabinet has agreed to make the following adjustments to the public health regulations. The current COVID regulations, which were set to expire on the 20th of March 2022, will be extended until the 30th of April 2022. The public health emergency will be extended for a further 60 days through the 29th of May 2022. And after the 31st of March 2022, there will be a mandatory indoor mask mandate for the following settings, namely, for those in healthcare or institutional settings such as healthcare facilities, nursing homes, rest homes, and correctional facilities. For those providing transportation for the public, which includes the indoor spaces of ferries, as well as on buses, taxis, and minibuses, as well as inside of the airport. Notwithstanding the limited situations where the law will require indoor masks, the Ministry of Health nonetheless strongly recommends businesses to set mask requirements for entry and the provision of services which are appropriate for their establishments. Scientific evidence has shown that the major route of transmission of the COVID-19 virus is via droplets and aerosols from speaking, singing, coughing, or sneezing. As such, masks have been proven to be an effective form of personal protective equipment. They are effective because they both block exhalation and virus-containing droplets and form a barrier to inhalation by filtering out droplets and particles. We recognize that there are many environments where people must be in contact with others outside their family group for long periods of time, such as at work. So we encourage businesses to think carefully about what mask policy is appropriate for their situation, both for their customers and clients, as well as for their staff. Having consulted with the Attorney General's chambers, the ministry can confirm that all businesses have the right to implement this simple public health measure in a manner that they choose. Between now and the end of the month, the ministry is working to update the public health guidance on gov.bm to assist the community as we continue to learn to live safely with COVID. In closing, I cannot stress enough how important it is for us to do our best to stay healthy and stay safe. Do not get complacent. Be very careful about your settings, mindful of the risk of not following public health guidance. I am very concerned about the increase in positive cases, especially amongst young people. Currently, the average age of our positive coronavirus cases is 36 years of age, and persons aged 20 and below are the main drivers of all of our active cases. To be clear, we all need to work together to reduce the spread, make sensible decisions regarding mask wearing, attending crowded events, and use your home antigen test so that you know your COVID-19 status. We must continue to look out for each other. We must act responsibly and adhere to the public health guidelines. This current outbreak is not over, and to get through this, we must take responsibility for ourselves and for others in our community. To decrease the odds of getting the coronavirus, increase fresh air ventilation indoors and avoid closed spaces, crowded places, and close contact settings. Continue to follow the public health guidelines, wear your mask, practice good hand hygiene, and continue to maintain physical distancing. Thank you.
Thank you, Minister. We'll now have a few words from Dr. Ayo. Dr. Ayo, you can also share your presentation on your screen. Thank you.
Thank you very much, honey. I will in a minute. I can get this to work. Can you see my screen?
I can. Well, it's blank right now.
Oh. Is it? No. Okay. Let me try something else.
Okay.
Okay, can you see my screen now?
Yes, yes, we can see it.
All right, thank you very much, Honey. Good afternoon, Bermuda. My name is Ayo Oinloy. I'm Chief Medical Officer. Thank you very much for the opportunity to speak. And like the Minister, I'd like to pay my condolences to the families of people, the individuals who's died very recently. Today, I will be talking about the epidemic that we have, and the pandemic and the way our outbreak has been progressing in Bermuda. To be building on what the Minister has talked about, I'll be focusing particularly on how this particular outbreak has affected our young people, and showing you some of the data around the outbreak as we have been able to see it here. So I'd like to start by sharing the outbreak curve for everyone. So you all are familiar that we have been dealing with different waves of this unfortunate pandemic. At the start, we had the wild virus, and much of that was the same when we had the spike late in 2020. Early in spring of 2021, we had a spike and wave that was driven mainly by the Alpha variant, and later on we had one that was driven by the Delta variant. Our most recent wave is driven by the Omicron variant. As you can see, the time between outbreaks appear to be getting shorter. But the other thing I wanted to point out, apart from the fact that successive waves has been bigger and stronger than the previous ones, is that it appears that the numbers are going in the wrong direction. As you can see this is the start of what we hope that is not the start of another wave, but it is going in the wrong direction at this point in time. Usually we are able to tell you what strain of virus is driving the outbreak. At the moment, we do have some challenges with our MDL laboratory, so we're not able to do the typing that is required, but we're working with colleagues in CAFA and colleagues in New York to be able to do that tracing and be able to give us more information on what is driving this outbreak. So over the last month or so, we can see a steady increase in our positive cases, our new positive cases. And as the Minister pointed out, you can see that when we look at the active cases, there are 271 active cases, as the Minister pointed out. The breakdown of the active cases shows that the bulk of our cases seem to be from the under 20s. This is reason over the last 2 weeks. It's become more prominent over the last 2 weeks. There could be several explanations for this, part of which is that our younger people are engaged in a screening program that allows us to be able to capture all the data, well, at least most of the data in that age group. Unfortunately, we don't capture all the data for everybody else in the community because people are taking, rightly so, taking antigen tests in the comfort of their own homes. But we have a lot of anecdotal evidence that suggests that not all the positive tests are reported to us for capturing. But what is quite clear is that the younger age groups are the one driving this particular active cases group that we are seeing. Okay. The other thing I wanted to mention is that the COVID-related hospital admissions tends to follow the waves that we have seen. As we can see, this is mainly looking at what we have been seeing since the third wave, or the second wave, I should say. We can see just couple of admissions there. we had when we had the alpha wave, there was more admissions, so about 7 per day at its peak. Where Delta has been by far the worst for us in terms of hospital admissions and death, with as much as 10 per day. We haven't seen the same level of hospital admissions with Delta, and this is figures up to the end of January. So there has been more hospitalizations and more deaths since this has happened. But thankfully, it's not been as bad as what we saw with Delta, and that's in part due to the level of vaccinations that we've had and the level of previous exposures that people have had. So this is where we are at with that. I'll then move on to explain a little bit more about the specific number of cases that we have seen in the younger age group. And bear in mind, this table is showing us the number of young people that tested positive at the time of the 4-month period that that Delta was the main driver of our outbreak. And you can see the total numbers just under 500 here, and the splits by the different age range here. We did have, for some period of time during this, school closure, so that could possibly explain some of the reduction in numbers that we saw. And I'd like you to compare that with, so the previous one was for 4 months. I'd like you to compare that with the 2 months period from the end of January to the end of, from the beginning of December to the end of January, where Omicron was the main driver. As you can see, we've had almost double the number of cases in children in that 2 months period as compared to the total 4 months of Delta. Recent data that we're seeing has shown that this number is even higher now, much higher now, but I don't have the complete data sets yet, and it's something that we can update later on. If we look at specifically at hospital visits, what we have done is to break this down by ER visits as opposed to hospital admissions and ICU admissions. As you can see, from 1st of August to 30th of November, this was a period of time where we had Delta as the driver for our outbreak. We had 9 ER visits over the period of time, 3 admissions spread out over this age group, and no ICU cases. However, if we move on to the period of time from 1st of December to towards the end of February, and this is the latest data we have. We will update this as soon as we have more data. You can see that the number of ER visits in the younger people aged less than 20, is actually tripled basically over that period of time. And although the actual admissions, there's really no significant difference between the 2 periods, but the amount of symptomatic children who are tested positive requiring at least an ER visit had tripled over that short period of time. This slide is basically to show that what we are seeing. So you can see the orange is people aged over 18 years, and the red is people aged under 18 years. And looking at our waves from March 2020 to this is till the end of February, we can see that not only are we seeing more under 18s getting infected, as a proportion of our total cases, this is actually increasing as well. And I think it's important for us to set this background. This is the rationale for some of the things that we have been doing with the younger people in Bermuda. The minister has just explained and highlighted the recent changes that the government is going to be making going forward. I need to emphasize again that this pandemic is not over. Do your best to protect yourself as best as you can by wearing face masks, washing your hands regularly and sanitizing when you can wash, and avoiding close, crowded indoor spaces as much as you can. And before I leave, I'd like to say thank you to all my colleagues who've worked tirelessly throughout this pandemic and are still working. I know we sometimes feel like this, but your hard work and efforts all throughout this pandemic is really appreciated, and you are real heroes. Thank you very much.
Thank you, Dr. Ayo. Thank you very much. And now we'll just have a few words from Dr. Miller.
Good afternoon, Bermuda. And I must say thank you to the Minister of Health and to the CMO, the Department of Health and their wonderful staff, and also, most importantly, to the public of Bermuda, who have played a significant part in helping us to manage the previous waves of COVID as well as this one, and whose cooperation will be important going forward, because as Dr. Ayo and the Minister have pointed out, COVID has not gone. It's still around. We have to therefore proceed with caution as we go about our daily lives and try to get things to normal. It's a new normal, a normal with caution. And we have to bear that in mind. The numbers seem to have been going up a little bit in the community. We have not seen a spike in admissions here, but there was a slight increase a week ago. Things seem to have been stabilized in terms of increased admissions here, but we know that is just one part of it, because the hospitalizations tend to lag at least a couple weeks behind the infections in the community. So we're still mindful, and we're aware that as the testing is done by some people at home, there is every possibility that some will not necessarily report, or they may have done a test early and think, oh, it's negative, and didn't bother to repeat it. So some people may be infectious without being aware, despite their best efforts. So that would therefore serve to advise everyone to be as cautious as possible. We have had challenges here in terms of staff being affected. In previous episodes, we were up to 100 or nearly of that order. At the present time, we have much fewer staff that are off. In fact, the last count, we had less than 30, but it's not just a matter of the total count. It also relates to where the staff work, because in certain critical areas, that could place a significant strain on the services, and indeed may even threaten whether or not we could offer certain services. Having said that, we have been able to deliver all our emergency services in keeping with our commitment, and we have also been able to keep the clinics and all the other elective areas open and functioning at capacity or near capacity. So that in the operating theater, one will remember that in the height of the Delta wave, we had to close the operating theaters because we needed the staff from the operating theater as well as the post-anesthetic care areas to help look after the many COVID patients. In fact, we had to create satellite ICUs. This time we made the preparation, but we did not have to use the facilities, and therefore we were in a position that throughout this Omicron wave, we offered normal elective surgery, and we were able to continue the various outpatient clinics. But in addition to that, we were also doing other things. Many people may have heard about the electronic medical record, and after many years of people within the insurance industry, the public, physicians, and various healthcare providers calling for and pointing to the importance of the electronic medical record, BHB has embarked on that path, and we're looking forward to being in a position to have a rollout late this year. That involved significant amount of work with our staff in various departments, and certainly I must congratulate and thank them for the enthusiasm and the energy that they have put into that project. In addition to that, we have also been looking at pathways to improve the management of stroke patients. And we recently had an accreditation from one of the big agencies, Accreditation Canada, and they were certainly very impressed with what they saw, and in fact asked whether they could use some of that as an approach that people may use elsewhere. So that's certainly something to make Bermuda proud. And we continue to strive for excellence, and we certainly thank everyone, including the members of our staff at all levels who participate in those programs and the various other efforts to make this all possible. In terms of new medications for COVID, folks have asked about them. Very early on, we did place orders for a range of medication, including some of the newer antiviral agents, the oral agents. However, we're forward in the queue, but still waiting. Thank you.
Thank you. Thank you, Dr. Miller. Thank you, Minister, and thank you, Dr. Ayo. We'll now take questions from the media, and we'll start with Mr. Gary Foster Skelton of the Bermuda Broadcasting Company.
Good afternoon.
Good afternoon, Gary, and welcome.
Thank you. Let me just make sure you've got my video. There we are.
Yeah.
Thank you very much. And Minister CMO, Dr. Miller, thank you for being with us today. My first question is essentially for Dr. Miller. Now, you've just said we are still waiting for treatment. So my first question was going to be, what coronavirus treatments for inpatients or outpatients do we currently have at the hospital? And what is on order in terms of particularly Paxlovid?
Okay, great. Well, I could answer you about the Paxlovid because I know you're interested in that, but probably you want that first, or shall I go and come back to this?
Well, please tell us about the Paxlovid first, and then tell us what we actually have at the hospital.
All right, good. Well, the Paxlovid, as you would have known from your research, is one of the relatively new oral antiviral agents. And so there's a lineup in many places in the world for it. So we have placed our order just like many other hospitals, but in terms of availability, we don't have, unfortunately, that is just in the position of the majority of
Okay. And so what do we actually have right now? Do we have anything that we didn't have during the Delta wave or in the early part of the Omicron wave? Have we anything since new since December?
We haven't had anything new since December. However, the important thing that I would wish to emphasize is that the cornerstone of treatment is first prevention, and then for those who did not, or despite their best effort that happens, then we depend on them having a steroid, and the preferred one, because it's readily available, easily administered, cheap, and without significant side effects, dexamethasone, and we have that. That's the gold standard. And for others who have problems with maintaining the level of oxygen in the blood, then it's a question of giving them oxygen, and the high flow oxygen has made a tremendous difference worldwide in outcomes. For patients in more severe situations, then we may have to put them on a ventilator or respirator. Now, for the inpatient, remdesivir, which is antiviral, but it's intravenous as opposed to the oral agents, has been and still remain one of the main ingredients. So wherever you go for inpatients, two things that they're bound to have would be, in terms of drugs, would be remdesivir and dexamethasone, with dexamethasone being at the top, remdesivir further, and then oxygen, either by face mask, high flow oxygen, or even on a ventilator, depending on the need. Now, coming back to your question about the Paxlovid, which is why I wanted to deal with that last, if I was permitted, the advantage that Paxlovid would have is that in some instances, if you did have it and you found patients who had mild symptoms, then administering that agent would reduce the number of hospitalizations. You would not be able to say, if I had 10 patients, I wouldn't be able to say specifically which ones of the 10 will not require hospitalization, but would certainly reduce hospitalization if you have them. The severe ones, that's out of the question. We're still going to have to admit them, give dexamethasone, remdesivir, oxygen by high flow, or in the worst case scenario, they would have to be ventilated.
Okay. And when did the hospital order Paxlovid?
Oh, we ordered it as soon as it was, as soon as we heard about it, even before we were absolutely sure about it, because we figured that it may be a lineup, so we thought join the line early.
So that was back in December?
Yeah, back in December.
Okay. What about...
Murray?
Oh, yes,
Yeah.
Dr. Oyinloye.
Yeah, thank you. Thank you, Gary. Just wanted to add very briefly to that. In addition to the orders that Dr. Miller's talked about, we're also working with our UK colleagues from the UK Health Security Agency to source at least some doses. They have, of course, a bigger market, and they are able to command a bigger market share. And we've been assured that we will get a proportion of the supplies available to the UK. So we expect that imminently. We're expecting the oral antivirals and also some more monoclonal antibodies for us. So that's going to come soon, in addition to the order that Dr. Miller has talked about. Thank you.
And that's Paxlovid you're speaking about.
Paxlovid and Molnupiravir.
And you said it's coming soon. Do you have any kind of sense of a date?
We've not been given a date yet, but the orders have been placed. We've been assured of our allocation, and we're expecting that pretty soon.
Okay, thank you. And go ahead, Dr. Miller.
And Gary, the sort of thing too, I just want to say they have a place in the armamentarium, but they're not magic bullets. And if we take something like the monoclonal antibody, which is good, like molnupiravir, the thing is that you have to be cautious in pregnancy. And in fact, if we were to give it to somebody who is likely to get pregnant, we have to make sure that they're on birth control, because there are certain concerns there. So in using them, they're not sort of magic bullets that would, sort all the problems out. So they have a place, but one have to mention them and realize that you have to put it in context.
And speaking about that they're not a magic bullet, and you mentioned prevention being the first course of action, but it does seem, as we are moving towards living with COVID, it's increasingly clear that societal prevention measures, curfew limits and gatherings, even mask wearing and social distancing, all these are either gone or being loosened, or some people are gradually abandoning them. And this means treatments for coronavirus illness are becoming more vital. Has the hospital adjusted in any other way to account for this?
Well, certainly that's part of the reason why we go through ordering this, because we think, okay, if we were to have a spike, we want to be ready with all that is possible available, because it would give us more options. But at the same time, one of the messages that we get through to our staff and our patients and their relatives is that, look, when something is mandated, it means that it's a law of the land, you have to do it. But though not mandated, masks would be advised and strongly advised in certain circumstances. So for instance, what I say to people, if you were in an outdoor setting, but you were in a jam-packed concert with everybody squeezing against each other, and you're likely to be in that environment for some time, it's prudent to wear your mask. If you were just walking along the street and you were significant distance from everybody, after all, we don't have the crowded streets that you find in some cities, then that's fair enough. So one has to exercise some prudence depending on the particular circumstances. And simple things we don't want people to forget, like frequent hand washing. It has done us well, not only for COVID, but for so many other things, the colds, the various infections of different types. So we still want to emphasize that hand washing, good hygiene will always have a place.
Thank you, Dr. Miller. And I have a question now for Health Minister Kim Wilson. The former science advisor, Dr. Karika Weldon, told one media outlet that it seems we're okay with announcing another COVID death every other day. Indeed, we have had now 16 coronavirus-related deaths this year. Is there now an acceptance, even a resignation, that living with COVID means we will have a steady number of hospitalizations and potentially deaths due to the virus?
I think, Gary, what we're seeing worldwide, and particularly in Bermuda with us being a small jurisdiction, obviously one death impacts us all. But as the messaging has been in recent several weeks, we're trying to take steps to live safely with COVID. And the reality is, unfortunately, there are going to be deaths. And whether or not, we like it or not, we're going to see deaths, unfortunately. It will adversely impact each and every one of us. However, as we've said previously, it is really critically important that we take steps to try to protect ourselves, as well as those persons that live amongst us that may be more vulnerable because of pre-existing conditions. We've said it over and over again about the importance of immunization and how it reduced heavily the severity of the disease, as well as hospitalizations and deaths. We've spoken about the 3 C's. We've spoken about mask wearing and so forth. So we need to continue to impress upon the members of the public that in order to live safely with COVID, we need to continue to follow public health guidelines. A lot of people think it's gone, and it's not. Bermuda is not a land on its own. And the reality is that as long as our borders are open and remain open, then which we have to keep open, obviously for economic growth and the like, but the reality is that COVID is still classified by the World Health Organization of a pandemic nature. So it hasn't gone away. So the best thing that we can do to protect ourselves and our loved ones and other fellow members of the community is to continue to adhere to the public health measures.
And with the Omicron subvariant spreading in the UK, BA2, or I don't know the other numbers, but has it been detected here? And does the government intend on taking any precautionary steps to mitigate the eventual rise in cases that's anticipated here?
Well, I'll yield to the CMO because he did speak about the typing and the variant typing that's happening so far as sending them overseas and so forth. But the reality is that, as we've said, from every one of the other variants, starting from the wild type variant to the Omicron to the B2, the measures of protecting ourselves against COVID are the same. So the same things that we spoke about for the wild type, for Alpha, for Beta, for Omicron are exactly the same. So those same public health measures will transcend the variant. So we have to just continue with that particular messaging. I'll yield to the CMO because he did speak briefly about where we were with respect to typing of the variants. But again, if I can just conclude by saying the public health measures that were applicable to help keeping us safe during the wild type and Alpha are the same that will continue throughout B2 or any other variants that might be floating around in other jurisdictions that may find themselves here.
Yeah, Larry, so I did mention in my presentation that we've had some challenges with the main government lab, the MDL, in typing the most recent samples, but we're working collaboratively with colleagues in New York and in Harvard to type the samples, our most recent samples. But yeah, you're right. Because of our gateway cities, I would expect that the recent uptick in cases has been driven by the B2 variant. But we need to confirm that by tests to be sure. However, while the B2 variant has in technical terms, what is called a transmission advantage, basically it's more transmissible than the B1, the original Omicron variant. Crucially, and thank God for this, it does not appear at this stage to have more serious effects, so it doesn't lead to more hospitalizations and deaths, which is good news for us. But a little of a lot is still a lot. We need to keep the numbers down if we want to keep our hospitals safe, if we want to keep our health economy safe, and we want to keep our country safe. Thank you.
Staying at least loosely on the ability to detect variants, Minister of Health, it's clear that there was a clash or a breakdown in effective communication between government and the former government science advisor, Dr. Karika Weldon. Is it reasonable to say that the former government science advisor was disliked by some members of the civil service and government? And if so, why?
I wouldn't say that it's clear that there was a dislike between the former
Breakdown of communication is what I said.
breakdown of communication. You'd probably have to best pose those questions with the civil servants. However, what I can say, which is critically important, and I've said it previously, Dr. Weldon is to be commended for the service that she provided to this country, certainly with respect to the assistance of establishing the MDL lab. And we have repeatedly thanked her and commended her for her commitment to that particular endeavor. The current situation, as I've also stated, is that the MDL lab will be transferred under the Ministry of Health as of the 1st of April. So in about two weeks' time, it will form part of the Ministry of Health. We will continue to provide the stellar services through MDL as it relates to providing the analysis of the testing and so forth. So the reality is we will continue to provide that service insofar as whether or not there was a breakdown in communication, so forth. Persons are entitled to their opinions. Advice is provided oftentimes to the government, but ultimately it is the government and the cabinet that make various decisions as it relates to what they feel is in the best interest of Bermuda. That's what we're elected to do. And cabinet is the one that sets the policies. It is the cabinet decision to set all government policies.
Does our inability to detect variants at this time, is that in part because of that breakdown of relationship between Dr. Weldon and the government? Because after all, Dr. Weldon put a lot of effort into being able to identify the Omicron variant almost as soon as it arrived.
The nuances insofar as the ability to detect the variants and so forth, I think the CMO has spoken to that. We have sent off some samples to CARFA, and we are continuing to work with our United States partners through Cornell so that we'll be able to detect and identify the variants that are on island.
So why did government not let Dr. Weldon rescind her resignation?
There was a statement that was came from the Cabinet Office that spoke to the issues at hand as it relates to the delivery of the resignation through Dr. Weldon. I think I invite you to go to the, I think it's the Tree Frog app, which speaks to the entirety of that statement. Regrettably, for some reason, it seems that the Royal Gazette didn't produce that whole statement, nor did I think ZBM when it was run, but the entire statement that speaks to the history of the relationship with Dr. Weldon. I believe there were several occasions when she has tendered her resignation, the most recent being the one that we're speaking about in December. But again, I'd invite you to look at that particular communique that came from the Cabinet Office that outlines the full details of the circumstances to which you speak.
Thank you, Minister, CMO, Dr. Miller.
Thank you, Gary. We'll now take questions from the Royal Gazette. Jonathan Bell.
Royal Gazette didn't produce that whole statement, nor did.
Hi, Jonathan. Turn your volume down, thanks.
Gotcha. Okay, video.
Thanks, Jonathan. We can hear you.
Thank you, honey. I'm on a strange computer, so I'm just trying to get this video started. And you know what? I don't believe it's letting me do that. Let me just... Aha! Success.
Yes, we can see you. Thank you.
All right, thank you. Thank you, everyone. I appreciate this. Minister Wilson, I guess I'll start with yourself. And hello again. Obviously, I've just heard you describe the efficacy of masks and the thinking behind that on the latest public health guidelines. But it for us in the media, it's one of the big issues that people keep coming to us with. There is a huge disparity between public events and our schools. We're getting reports of conferences, other large events where it appears very few people are wearing masks. discussions can you tell us about what's happening in terms of schools being able to see some loosening of restrictions on masking and quarantines? Is anything foreseeable in the current academic year? I wanted to start on that one.
Thank you, Jonathan. That's a very important question because I know a number of members of the public have been raising that. But I can say that obviously the policies as it relates to the masking and the other other measures in the schools are set by the Minister of Education, and I anticipate that you'll be hearing further details from him in short order concerning the policies that education is setting as it relates to continuing with the mask mandates and the like. So he will be producing information to members of the public very, very soon.
Right, and I hear you on that. I know cabinet is private, but as a health minister, you're part of the discussions, aren't you? Is there anything that you can tell us in that regard?
As you said, cabinet is private, and deliberations and discussions that take place on a Tuesday remain on the Tuesday in that cabinet environment. However, again, I would anticipate that in very, very short order, members of the public will be and members of the media will be addressed by the Minister of Education, who of course will set the policy as it relates to things like mask wearing. And you'll hear further details from the Minister of Education in due course.
Appreciate you. I wanted to go back to MDL. It's a two-pronged question, I guess. What specifically is the challenge that we're having at the moment with variants? It sounded like not too long ago we had some pretty fancy equipment for dealing with variants. And should we end up in a situation where we have these cascades of cases, how quickly can MDL pivot if it needs to going back to mass testing? So it's really what happened with the variants testing and how quickly can it have the revenue and the manpower to, do that mass testing should we need it?
Okay, I'll yield to the CMO with respect to the variants, but you'll recognize, Jonathan, up until several months ago, actually, the majority of the testing that was taking place in Bermuda was PCR testing. And of course, the analysis of the PCR testing does take place at MDL. We have pivoted, and the vast majority of all testing that takes place now is the at-home antigen testing or the antigen testing through supervised antigen testing at a doctor's office, pharmacy, and the like. So there is less need for the PCR testing at this point because all of the testing, you can go across the street to a local grocery store and buy your antigen testing, which we're encouraging people to do, and test yourself. Or alternatively, if you are required to do supervised antigen testing or antigen testing for travel and the like, there are locations that are doing that. So the majority of our testing, probably over 80% of all of our testing that's taking place now in Bermuda is through the antigen testing. So it's not through the PCR, which was obviously in high demand several months ago, last year this time, and the year before that when we first opened up the MDL lab. But over 80% of all testing is done through the antigen testing. So there is not the need for that heavily resourced lab as it relates to the analysis of PCR because we're not doing PCR anymore. The whole world has changed. Everybody's pivoted, if I can quote you, and they've pivoted to antigen.
Yeah, so one of the folks who spoke made reference to a specific challenge that we're facing with getting those variants. Is it something, piece of equipment that isn't working, or I was curious about that part as well as how.
I think the CMO is getting ready to answer you.
Yeah.
Yeah, Jonathan, hi. I can have a go at that. So I think it's important to understand what we mean when we talk about sequencing. There's several. I think it's easy to mix up the issues. What we do in Bermuda is typing. So it tells you gross type. So are we dealing with Delta? Are we dealing with Alpha? Are we dealing with Beta? Or the type? So the family group is what we're able to do. And that's because we look for specific changes, small changes on the spike proteins that allows us to be able to say what type, what family group it belongs to. Now, to look at the specific subvariants, you need to do the deep sequencing. That's you look at the whole 30,000 base pairs on the genetic sequence of the virus. And then you can look specifically at the areas that are able to tell you, are you dealing with a BA1 or BA2 or BA3 to be able to tell that. We were able to do that on one occasion, but that was done by equipment and staff being flown in from New York to do that. But that was just a novelty to show that it could be done. We still have not got to a situation where we can do that on a routine basis in Bermuda. So that remains to be done. That bit that will give us that extra information on what exactly we're dealing with still has to go outside the country. And that's what I was talking about with CARFA and with New York. Yeah. But the gross typing that tells you what family it belongs to can be done locally. However, we have machines that need to have downtime that are between uses, and one of those machines is having a downtime now, needs a couple of things to get it back up. But we have one machine that is functional and giving us all the results that we need. But we cannot use the same machine to do typing. If not, there'll be problems. So that's exactly where the situation is.
Dr. Ayo, are you confident that MDL, God forbid, if we end up in one of those situations that we've been in where we just have tons and tons of cases and we need to do tons and tons of testing, that it can quickly get back up to speed and do that?
I'm not responsible for MDL at the moment, but I speak with colleagues who are, and the assurance I have received from them is that we can pivot to do that. As the minister said, we're unlikely to ever get to a situation where all of our testing will be PCR. Again, we would need, we are already using a lot of antigen tests, so there is sufficient buffer capacity, as I've been made to understand, if we need to make a surge testing.
Thanks. The third question that I had, and it is a bit of a crystal ball question, it's a hypothetical. If in the event of one of these surges coming back, are there any specific triggers that would put us back in tighter restrictions, or are things like curfew and the like old thinking? And what happens and what triggers are there if we end up in a big surge of cases in terms of tightening our restrictions?
Okay, I'll probably start. I'm sure the minister would like to add to that. But the first thing to say, as the minister said, the cabinet makes this decision. So what we do in epidemiology and surveillance unit is to monitor the trends. So we're interested in the number of cases, number of people ending up in hospital, number of and the types of cases and the number of deaths that we get. And we're also interested in finding out what sort of variants we have and what the literature is telling us about the severity of these variants and the number of people that this affects. So we have a matrix that we work to, and we colleagues who are on the public health emergency response team will see this matrix because we go through it every 2 weeks. And internally, we actually go through it 3 times a week. So we always keep this in mind, and we pass this on to those who are the decision makers who decide what they want to do with it.
Right on. Minister, is there anything you could add to that, or is that just something that comes up when it comes up when you discuss it in cabinet, if it were to get to that?
No, the CMO is right. The matrices and the things that he spoke about with respect to what they're looking at to provide information and recommendations to the cabinet. The cabinet ultimately, as I've said before, are the policymakers. However, we do hear the information and receive the information on a regular basis, and that information is passed to the cabinet to assist us with respect to any policy decisions that are made.
Right on. Thank you.
Thank you.
So we're looking at mass vaccination stopping end of the month. Minister, you touched on this with people getting their shot, their jab from their doctor or from pharmacies. There must by now be some guidance from the insurers on how that's going to work. Are you able to tell us anything in that regard on how it's financed? Ditto with the PCR. What's happening with PCR testing in Bermuda at the end of this month?
Well, like I said, Jonathan, virtually over 80% of all the testing that's taking place is done by antigen testing. There's a small amount of PCR that's taking place. The saliva testing for preschools and primary schools is PCR based, but that's only about 2,000, between 2,000 and 3,000 a week. And that's with respect to the students. Persons that are going to Canada require a PCR test. That's not that. Yeah, that's not that's at this point. I mean, there's discussions that might change, but to enter Canada, you're requiring a PCR test. So that's not a lot. The majority of the PCR testing that's taking place in Bermuda right now is with respect to the preschools and the primary schools through the saliva testing. And again, that's between 2,000 and 3,000 a week. So that's substantially less than what we were doing several months ago. The other question that you asked, about the testing, the vaccination. Vaccination is going to be, I want to say $29.95 per shot. The copay is going to be, I believe GEHI is the only one that has a copay. The other insurance companies are not requesting a copay with that. So it's a small amount, but again, we would encourage persons to take advantage of the free vaccination clinic that's still operating at the Hamilton Clinic as well as Pier 6.
I'm going to be going to Canada in a couple of weeks, so I'm glad to have gotten that bit of intel. Just quickly moving along, we've seen these deaths reported in recent weeks, and it's a question that comes up, and privacy is always cited. But as generally as possible, what are the age ranges we're seeing, and what possible comorbidities are standing out in these people whose deaths recently have been linked to COVID-19?
Okay, just give me a minute. I'll try and get that information. I was just looking at it a few minutes ago.
Oh, okay.
But I think the main thing to say about it is that unfortunately the bulk of the deaths that we're still seeing are in people who are not vaccinated, and that's about 80% roughly. The other thing that is quite clear is that those who are vaccinated and have died tend to be older with multiple comorbidities, particularly renal and diabetic type comorbidities. What we find with the unvaccinated COVID-19 deaths is they tend to be younger, and they too have comorbidities, but not usually in the same level of severity as what we find in the vaccinated.
Thank you for that, Doctor.
Oh, sorry, Jonathan. I think I found what the CMO was looking for, because we did get the report. With respect to deaths, 95, Jonathan, were not fully vaccinated, and 18 were fully vaccinated. That's of 113. Yeah. And then I think that information is going to be put on the website, because we're going to be updating it in a little while. So deaths among fully vaccinated would represent 16%. The average median age was 79, as the CMO alluded to. And
okay, that was the one I wanted, yeah.
Okay, deaths among not fully vaccinated, the average mean age is 70. Sorry, the average age is 71. The median age is 70.
Thank you, Minister. Last one for me here. Are we still in the same outbreak? Is the Omicron outbreak that really peaked in early January still, and I guess it's open to anyone, do we consider ourselves still in that same outbreak, or does it even work at this point?
Okay, it's difficult to say. Specifically, I suspect that we're still in the same outbreak, and the reason why I say that is all the tests that we've done recently have suggested to us that this is still the Omicron variant. Whether the subtype has changed, that needs to be determined. The other thing is that we never really got completely out of Omicron, the Omicron wave, before I showed you the slight rise that we're beginning to see again. The other point to make to suggest that we're still in the same wave is that this is similar to what is found in many other countries in the world, particularly in the US and the United Kingdom, where they had basically increase in cases following relaxation of public health measures. I suppose the thing that we need to be careful about in Bermuda is a much smaller place, much less health resources, so such effects tend to be amplified.
Thanks, everyone. I believe that's it for my questions today. Thank you and stay safe.
Thank you, Jonathan. Thank you. Thank you, Dr. Miller. Thank you, Dr. Ayo. Minister, did you want to say anything before we conclude the press conference?
Thank you, honey. I just want to thank Dr. Miller and Dr. Ayo for attending this afternoon's press conference with me, and to remind members of the public that regrettably, COVID pandemic has not gone away. We are still in the midst of it. You would have seen the information that was shared by Dr. Ayo insofar as where we are with respect to the trajectory. We are seeing increases of cases. Unfortunately, we're seeing more cases as opposed to recoveries. So we need to ensure that members of the public remain safe. And the best way to do so is by ensuring that they wear their mask and follow all of the public health guidelines. Thank you.
Thank you, everyone. That does conclude today's press conference.